Look at this. We are live. Back at it, Dr. Dave.
Welcome back.
Everybody. Welcome, everybody, to this latest edition of Tech Doc's Lunch Chat. We have a fantastic show. Do we call it a show, Dr. Dave?
We call it a show, webcast, podcast,
live stream.
all the above.
Yeah, it was a fun one today about how to incorporate an easy workflow for supplements. We've been doing these for over a year, Dr. Dave, and we are happy to welcome Mr. Dr. Alex Keller, naturopathic physician from Fullscript Medical Director. Is that right? I basically just did your intro, but let's go around before we get started and do quick intros for those people who tune in every single time. They know us. I'm Dr. Brad Brown. I'm the medical director for Hint Health, and I have my own DPC clinic a couple clinics in the greater Denver area. Go ahead, Dr. Dave.
Yeah, Dave Cameron. I'm the Chief Medical Officer of Hint Connect. It's interesting because we do longevity in our practice, and we have a number of patients that have a long list of supplements, or they have requests for me to take a look at some supplements and give some recommendations, or they come with a list and say, hey, which ones should I take? Which ones should I not take? So all of the above. And I think this is going to be a really fun, timely discussion to see if we can help simplify that. And I'm looking forward to having a great conversation with Dr. Alex. Dr. Alex, give us a little background for yourself.
Awesome. Sounds good. And thanks for having me on the show/webcast. It's great to be here. And that analogy about people coming in with a list, we talk about that all the time. The bag of supplements that people come in with, and they say, here's everything I'm taking. What do I do with it? Just completely overwhelmed. As Dr. Brad mentioned, I'm a naturopathic doctor. I'm in Ottawa, Canada, which is where Fullscript, the tech platform, was originally founded. So I have an active practice. I focus mostly on men's and mental health. And it just serendipitously worked out that about 7 years ago, I knew the team that was starting up Fullscript, and I happened to join them very early stage. And we've gradually been growing in the meantime to being this tech company that's kind of now plugged in all over the place. It's you have to pinch yourself sometimes in a similar way as I'm sure you both feel with Hint, where Hint is not that old a company, but now in the DPC space, you're kind of ubiquitous. Everyone knows Hint, right? That's
so true. I mean, Hint is to DPC what Fullscript is to all things supplements and even more, right? I mean, and yep. Fullscript has done wonders for investing in the DPC community as well, because so many, just like Dr. Dave's practice, and so many DPCs, direct primary cares, it's easy to focus on lifestyle medicine, and we have the time to sit on the couch and go over the whole bag of supplements, but also the whole bag of big pharma stuff too, and so do the longevity thing. And so Fullscript, it's almost Fullscript is obviously the tech platform, but supplements and everything that comes with that as a whole is almost just a seamless integration. So I love it. Sorry, Dr. Dave, you look like you were about to say something. I cut you off.
No, go ahead. I actually want to hear a little bit more about Alex, your kind of how you got involved at the what are your interests, and how did you get involved in kind of what you're doing now, and then start diving into a little bit about Fullscript.
Yeah, sounds good. I like I said, it was serendipity how I got here. I had started a clinic after graduating my med school, and was well into that when I was connected with the founders at Fullscript. And probably like a lot of us, I was finding that the one-on-one practice was very rewarding, but also very limited in terms of reach and what you could do. So the opportunity to work with Fullscript, which at the time was very well known in the naturopathic space, I wouldn't say as well known beyond it. So I knew it well. I was using it in practice, and I felt like, this is a great way for me to balance the one-on-one practice model with being able to impact people on a much broader scale. And it was shortly after that, not at all my doing, but just the right timing, that we started to expand significantly in the US, having been mostly focused on the Canadian market up till that point. And now, I mean, as we're seeing with DPC, there's just this explosion of practitioners wanting to recommend supplements in their practices. And I think COVID especially accelerated this, where there's just been this hunger for a preventative model, and people waking up to the fact that supplements are not necessarily quackery or woo-woo medicine, that there's a lot of evidence behind them, and that if used in a judicious way, they can be extremely effective in practice. So we've just seen this exponential growth in the last few years amongst conventionally oriented practitioners, people who have no background in naturopathic, functional, or integrative medicine, wanting to come use the platform instead of saying, hey, go to CVS, go to Walmart, go to Amazon and buy or get a vitamin D. They'd much rather use a platform like Fullscript now to be able to connect with their patients and make sure they're taking the right thing. So again, I keep bringing it back to DPC in this case because we've been talking with you, Hint, about doing some sort of an integration for years. And it's great that we're finally here because I think you've seen a similar explosion in recent years where people are looking for a much more personalized, accountable care type structure when they're engaging with the clinician. And so there's a lot of synergy here between people looking for prevention and looking for accountable care, and our two platforms now finally coming together.
Where are you sourcing your supplements from?
Good question. So we work with over 400 different manufacturers directly. So we have those products from those manufacturers shipped to our 5 warehouses and distribution centers. So all of the distribution of the products is done through our network. That's quite a difference to when you're dealing with something like Amazon or another e-commerce platform where you may be dealing with third-party resellers. The nice thing about this is you have a direct guarantee that the products are coming from the manufacturer to our warehouses and then straight to your patients.
Okay. Well,
go ahead.
No, you go ahead.
No, you first. No, I love you. No, that's one of the things I actually, when I did my own personal for my own practice, did my vetting process for Fullscript was, if I can give you a shout out right in front of you, was you can trust the brands on Fullscript. I mean, you go to any other e-commerce platform or go to any brick and mortar store and you get 37 different vitamin Ds on the shelf and you're like, I don't even know what is what or what is actually in it. And so I know Fullscript has can you talk to the level of, I don't know, purity is the right term if we're watching Breaking Bad or anything, but on
97.5%.
Right. Of what's the level of, hey, we really screen our supplements and our suppliers and our brands heavily. So then, the docs, that's a pain point for me that I don't want to have to do that. Right. Can you talk to that a little bit?
Yeah, happy to. So this speaks a lot to our quality program that we have at Fullscript. So at its bare bones, we have a rigorous onboarding process where we go through all of the third-party certification, including things like GMP certification, or anything beyond that. Their documentation of how they're manufacturing the products and making sure that they have proper certificates of analysis and a whole bunch of other stuff to make sure that at a baseline, we have the brands in our catalog that have been pre-vetted. And then from there, we take it to the next level where we do our own independent testing. So we take products off the shelf randomly every quarter and do testing with a third-party lab. And we confirm that the products are what they say they are. So quality is a really big topic in the supplement space because the bar of entry is relatively low to get into the market. It's actually amazingly low. So if you have a product that includes ingredients that are already on what's called the DSHEA list, so they're not new dietary supplement ingredients, you can bring a product to market without having any FDA oversight, at least at the outset. And then eventually they may catch up and do a GMP audit on you. But you might be in the market for months or years at that point, and there's no quality control. So it's pretty crazy what's available in the US market when it comes to supplements. And here again, like there's extra assurance when you're using a catalog like ours to make sure that you're not just, in the wild west of supplements. And like I said, then we go with that extra step and we're testing for things like purity, potency. We're evaluating evidence claims on certain supplements, and we're making sure that, again, the products are what they say they are. So one quick example on this is we recently did a test on 100 magnesium supplements in our catalog to make sure that the label claim matched the potency of the product. So let's say it said 100 milligrams of magnesium, elemental magnesium per capsule. We wanted to make sure that that was accurate. So the average that we look for as a range is between 95 and 105%. That's more or less considered acceptable. The average of the products that we tested in Fullscript was 97%. So that was considered kind of smack in the range. We compared that to one of the companies, Now Foods, which is a good high quality company. They did an assessment of products that they pulled off of Amazon, and some of the products they were pulling off had potency ranges of like 50% or less. So we compared those to some of the products we were testing. We were just showcasing again that when you're purchasing products from an unregulated or uncontrolled market or an e-commerce setting, you don't know what you're getting. You're not sure, and that's at the best case. If it's low potency, it's not dangerous. If it's not pure, it can be dangerous when it's laced with things like pharmaceuticals and others.
Well, it's interesting. I see a lot of people that are Peter Attia followers, and so back in December, he had the CEO of Pendulum come on because they were talking about the new probiotic Akkermansia. And it was being marketed for GLP-1 activity, weight loss, glucose control, and we got just a lot. And actually, a lot of our patients were having a hard time getting it from Pendulum because there was so many people that were. And I went to the website, and definitely Akkermansia is on there, and Pendulum. And I don't know. Do you find are you able to source enough of that when it's under this high demand? Tell me about like your experience bringing Pendulum onto the platform.
Also a great question, right? So there are certain brands like Pendulum that have significant marketing presence, especially in the consumer space. So they've done an excellent job of bringing quality supplements to prominence and backing them by evidence and again, bringing a lot of awareness to them. The trouble with that, as you're highlighting here, is that when you have an audience like Peter Attia's, you can drive extreme interest in a product and all of a sudden sell everything out. So the benefit, again, in that sense with Fullscript is, one, we are a prioritized distribution partner of manufacturers like Pendulum. So we tend to seldom run out of stock with these high volume products. And we have our own inventory that even when there's a spike in interest, like through Peter Attia, that we have a resilience to that in terms of running out. The other factor, which isn't as relevant with Pendulum because there's not a lot of comparable products in the market, is that we have redundancy in categories so that if one zinc product is out of stock, we have other zinc options that you can use, for instance. So that's again a benefit there. It all ties back to what exactly you need for your patient, right? So if you're trying to build a plan and you want it to be high quality products, okay, well, we've checked that box. We've done the vetting. We make sure that the products from a manufacturing perspective are top quality. The next step up is, do the products have sufficient evidence to back what it is that you're trying to do? And I think, again, that's where a lot of people have resistance to using supplements, because there's this perception that there's not a lot of evidence supporting supplements. I'd say there's a big distinction there between ingredients versus finished products. From an ingredient perspective, when you're looking at zinc, magnesium, omega-3, and so forth, there's lots of evidence supporting those ingredients and specific uses. Where there's not as much evidence is in the combination of ingredients into finished products. And Pendulum, coming back to your point here, is one company that's gone above and beyond and done their own clinical trials and worked in an academic setting far longer than they've been to market in a commercial setting, to the point where they can come to market with clinical evidence supporting their products. We are now seeing more and more of these products come to market where people have taken the end product and actually put it through a clinical trial to confirm its use in certain situations. So just calling that out again for people who are wanting to learn more about supplements, you have to understand that there's a distinction here between ingredients and end products when it comes to clinical evidence. And it's good to look for the products that have that end product validation, like Pendulum's products, which is why they get so much attention and why they can market the way they do.
Nice. Thank you. We do have a question from the audience, actually. We're going to put you on the spot, Alex. You ready? A couple questions. Oh, here we go, from Jamie. Sorry for the naive confusion. Do you carry Pendulum products, or are you competitor to Pendulum? So you just answered that. You do carry them. Yeah.
We are not a competitor to any manufacturer of products.
Yeah.
We don't.
You're a facilitator.
That's right. Yeah.
Yeah. Good question.
We're a platform that connects practitioners and patients, similar to in that sense, right? Like you're helping to manage the workflow. And we just offer up a catalog of over 400 brands of products, over 20,000 different SKUs that people can use to build their treatment plans for their patients.
Nice. Another question from Ted Kapanji. Does Fullscript use orthomolecular products?
We offer orthomolecular products, or we carry them, so you can use them. We don't use them.
Good semantics here. Yeah, no.
Molecular, for anyone listening, manufactures really good quality products. They're one of the few brands that are very limited to where you can access them. So very limited to the healthcare provider channel. They try to stay off of Amazon and any other e-commerce channel to ensure that it's just HCP exclusive.
Awesome. No, good question. So I know we're like badgering you with questions because it's really cool. Fullscript is awesome. I use it in my practice. For
See, I lost Brad. I don't know if Alex, can you hear Brad?
I can't hear Brad. I can hear you.
Okay, I think I'm going to jump in because I think Brad might be having some connectivity issues. Let's talk a little nuts and bolts. How are some of the? And I've been doing my research here, but I want you to focus a little bit on kind of some of the features that help us in our practices, like how there's some comparisons and ingredient breakdown if there's multiple ingredients, how there's some price comparisons, templates, and all that kind of stuff that are designed as tools to help us when we're in with a patient.
Yeah. So I want to talk about this in not a salesy way, right? Like, we're all clinicians and we all use these tools in a way that's useful for our practices. So, I think it comes down to where you're at in the experience and what you're trying to do with your patient, right? So first things first, when you sign up for Fullscript, there's no cost. It's a zero cost platform. You can sign up in 5 minutes or less. There is one step where we need to validate that you're actually a clinician. So we ask you to upload your certification or your license. And then we'll vet that, make sure that you're a clinician, and then you have access to the platform. From there, you write a treatment plan through the platform to your patient. And you can do that in a variety of ways. You can do it through looking for ingredients. You can do it for looking through products. And then once the plan is constructed, you can also add resources. We have a library of patient resources that help reinforce the plan that you can access. There's well over 300 resources now that are like diet guides, explanations of different supplements, condition explanations, lifestyle recommendations, things like that. And then you send it to your patient, and from there, the patient fulfills the order and it ships to their house, like an e-commerce experience. The magic then starts to happen in terms of Fullscript keeping your patients on track with their plans. So this was the original impetus for Fullscript. When you sell products in office, or if you send your patients somewhere else to purchase the products, there's not really a mechanism there to help them stay on track with their plans. Fullscript is that mechanism within the supplement realm. So through either automated reminders based on how you write your treatment plan, let's say, Dr. Dave, I want you to take magnesium, 200 milligrams, so therefore 1 cap 3 times a day for 3 months. The system will automatically calculate how long that one bottle will last based on that prescription, and then it will automate the reminders on when to refill the product. Alternatively, it will prompt the patient, do you want to be on an auto ship or an auto refill of this product to make sure you stay adherent to the treatment plan in that time. And so there's all sorts of tools like this that are meant to automate the adherence path for you to make sure that your patients are staying on track with their plans. Where we're going as a next step is taking another step further, where we want to help with maintaining journeys for patients. So let's say you need to put a patient on an elimination diet or some sort of protocol to start, but then 3 months later, that protocol needs to change. And another 3 months later, it changes again. How can we help schedule that out so that we're keeping your patient on track for a much longer period than just based on the current supplement plan? So that's the next iteration of what we're thinking about now. While you're building the plan, you also have access to tools like template library or protocol library, where you can search by condition. And we have a pre-developed set of protocols that you can access.
Hey, welcome back.
Internet burped.
Sorry about that.
Continue. Don't let me interrupt.
We're talking about protocols, like we talked about earlier. So we've got this library of ingredient-based protocols, and we do it that way because, like I mentioned earlier, the majority of evidence in the supplement space supports ingredients. And so we've built the protocols based on ingredients, and then you can build the product selection based on that, whether that's a combination of products or individual products by ingredient. We have a number of resources outside of the application as well for learning how to prescribe supplements. And then I should mention, for some people, margin matters on how, when they're selling the product, how they're potentially collecting a margin of the sale. the nice thing again with DPC practices, correct me if I'm wrong, but most DPC practices, are they membership based?
Yep.
Right. So people are paying a membership, and oftentimes you want to include an incentive as part of that membership. So being able to offer discounted supplements is something that a lot of people with DPC practices tend to want to do, as we've seen. And you have 35% that you can work with as a clinician. So if a product sells for $100 MSRP, at top margin, if you're maximizing your margin collection, you as a clinician would be collecting $35 of that $100, and you can bring that all the way down to zero. So let's say you want your patients to have a savings of 35%, you can bring it down to zero, or you can do anything between 35 to zero in 5% increments.
Okay, that's really, and to summarize, I think this is a really important point because a lot of our practices are small, like we don't have a lot of space here.
Yeah.
That one, correct me if I'm wrong, but you can either order them and dispense them in your office, or you can set it up so that you ship directly to the patient. You could do either one. Is that correct?
That is correct. Yeah, I kind of veer towards the ship to patient piece because that's what the majority of people end up doing. But yes, okay, you can also order wholesale through your site and then dispense some products like that. What we see a fair amount of people now doing is hybrid dispensing, where they would dispense in office the products that are very common to their practice, and then the refills would be captured via the platform where it just ships directly to the patient. So the patient doesn't have to keep coming into the office to get the next product. But yeah, both options are available.
Are there financial reasons to order in bulk in your office and then dispense, or does it not make a difference?
It kind of comes out in the wash. So you do get a bit more of a discount when you're ordering wholesale. And when you go and sell it, then most people mark it up at that point. The challenge there, and what we've seen over time, is that through product loss, either product expiry or administrative burden in managing your inventory, you end up having cost increments that end up balancing out to the margin being about 35%. Yeah. So you can take that risk and order more products in office at a lower margin of 50% and then mark them up from there, and hopefully it works out. But we have found that it doesn't really make that much of a difference when you take the extra costs into account.
So I got a question. So patients are always asking me like, hey, what do you think of this supplement? And sometimes I don't know. What educational resources are available?
I just send them to ChatGPT. They have all the answers. No, so we have an extensive library of resources. We're actually rebuilding what we call Fullscript Academy right now. If you want a sneak peek of what the current experience is like, you go to academy.fullscript.com, and you have education there in the form of courses, guides, articles that you can review. The other place right now where the majority of our content sits is on our marketing site, fullscript.com. And then in there, you go into the Learn section, and we have a blog with well over 500 articles, all supporting supplement use. We have the protocol library I mentioned. I should also mention we have in that library, so not the application library, but in the marketing library, marketing side library, there's protocols that are product-based from our partners like manufacturers or key opinion leaders in the space. If you just want to kind of get a sense of other options, we have well over, I think it's now 300 protocols in that library. We have ingredient reviews. That is one of my favorites. I'm very evidence-based in how I practice. So we started building out a library of ingredients and what their various uses are supported by evidence. That's all in that library as well. And then we have a full library of webinars that we've curated over the last approximately 5 years, where you've got, I think, about 200 or 300 webinars now that you can search by based on certain topics. So let's say you've got a patient in front of you with IBS and you don't have a clue where to start. Right now, the best path is you go into fullscript.com and you go to the Learn site and you search in the bar irritable bowel syndrome, and it'll populate everything that we have available on IBS. Alternatively, you go into Fullscript platform, you log in, and you look at the protocol library, and you can search irritable bowel there, and the protocols that are relevant to that should show up. Or you can search by gastrointestinal. There's other protocols that show up like that as well. So that's the current experience. In about 2 months, all of this will be united in Fullscript Academy, and it will be a single sign-on. So once you're logged into Fullscript platform, you'll have access to the Academy and be able to do everything in one place. We're really, just to emphasize, kind of reinforce your question here, with more and more people coming to the supplement space without having prior training in it, we have made it a major mission of ours to help get people started with supplementation use. And so the FS Academy is a big piece of this. We're also about to launch a supplement certification course with A4M, the American Anti-Aging Academy of Medicine, where that's now at a cost. But if you want to do a real deep dive on all things supplements, then you can sign up for that certification. It's a 16-hour CME course teaching you how to use supplements safely in practice.
Great.
That's awesome. So I know we're coming up right on time here, and we actually all have patients that we have to go see soon. So we're not going to take too much more time. But anything else that you want to mention, Dr. Alex, about Fullscript or anything that you have? Because you've covered it great. You've covered more than I know about Fullscript personally. But is there anything else that that you want to cover? It looks like we have a couple more questions from the audience if you don't have anything off the top of your head.
Let me highlight one thing I
Sure.
mentioned in the kind of workflow and the benefits. Let's go back to that bag analogy when patients come into the office with a bag of supplements. Because of that challenge, which we've heard from so many clinicians, we came up with a new feature called Current Supplements. So Fullscript has a mobile app for patients. And this feature works the best when patients are using the mobile app, but it works through a typical computer as well. When a patient is joining your practice through Fullscript, they can enter all of the supplements they're currently taking, whether or not that's through Fullscript or elsewhere, because we have the entire NIH database that people will have access to. So if you bought a Kirkland omega-3 or a CVS magnesium, it will be in our database and it will be uploaded so that once that's done, you, the clinician, will see every product that they're currently taking, and it will summarize all of those products into an ingredient table so you can see all of the ingredients in aggregate that they're currently taking. So imagine, again, you have multiple products that contain magnesium, and you see in the ingredient table that they're taking 5,000 milligrams of magnesium per day, some crazy number. You could right away call out for them and say, hey, red alert, first thing let's talk about, you're taking too much magnesium, and that's why you have loose bowels. Just as a funny example, right? But it's for that reason that we created this feature. So the way I do my workflow at our clinic is when a new patient joins our clinic, they automatically get an invitation from our EMR and they get an invitation from Fullscript. And now with the current supplements feature, they're prompted to upload all of their supplements, and through EMR, they're prompted to upload all of their medications so that I have all that information right when I see them, and we can start talking right away about their current plan.
Nice. That is so cool. That is almost a catch-all fail-safe too for those loose bowels and everything else. No dangerous, couple questions. Is there a list of all the brands that you carry on Fullscript?
Yeah, I think it's fullscript.com/brands.
Hey, that's creative. Cool. But you do have a list. That's awesome.
We do. I mean, when you log into the application, you can see right there brands, and it'll give you a full list of all the brands available. Alternatively, you can also just search for the brand, and our search experience is very filterable. So if you want to search orthomolecular magnesium, you can do that. If you want to go even more granular and say, I need a product that has magnesium, zinc, ashwagandha, and curcumin, you can add all those ingredients up and list whatever products have those ingredients in them.
Sweet.
So,
combos. Does Fullscript integrate into EMRs?
Yes, we do actually. Good question. So we integrate now with at least 30 EMRs, which cover the vast majority of the integrative and the functional space. Several DPC strong EMRs as well. Hint Connect, I think we were working on that integration. Is that correct?
Hint, yeah.
So we've got not the Hint Connect yet, but so yeah, we are integrated with many EMRs. I don't remember the number off the top of my head, but I think about 25 to 30% of Fullscript users currently use Fullscript primarily through their EMR. So we're going to see more and more evolution in that space because there's more and more demand for people to use them embedded within the EMR instead of having to jump out to a separate window. So there's a lot of work going on in that space right now.
Nice. That's even more convenient. Just take away as many pain points from us docs as possible.
Exactly.
I think last one, is there an estimate of what percentage of DPC practices recommend supplements via Fullscript? I don't know if there's any way that specific level of DPCs, but you said 30% go through their EMR. I know DPC has a lot of lifestyle medicine, longevity medicine, like Dr. Dave. I know it's definitely up and coming. It's here, and it's only going to grow more in the future, which is why the partnership between Hint and Fullscript is only going to be stronger. So
yeah, maybe I'll mention this, that Haley, I don't know if you're here and you can pull up slide number 3 in the deck, but there's some good stats here. So we put a deck together that we definitely did not use, which is just fine because it's a good organic conversation. But just to highlight here that the comparison of U.S. adults currently taking supplements is around 74%, with 55% of those qualifying as regular users of supplements. On the right, you can see 79% of physicians and 82% of nurses currently recommend supplements to their patients. So it doesn't directly answer the question about how many DPC practices use supplements, but there's obviously a very large majority here of clinicians that currently recommend supplements in some way with patients.
Excellent. That's awesome. Last one before we go see our patients. If we're interested in creating an account, what are the next steps? Jamie, this is a fantastic one to close on. Thank you for asking this. This was not, we didn't ask her to ask that, but what do we do?
Yeah, and I think there's a link right there. So if you want to get started, you use this link. We have a landing page as well dedicated to Hint. I think this link goes to that landing page that explains more about the integration, the user flows, and then from there you can create an account. Like I mentioned earlier, it's a super easy process, less than 5 minutes. There's no cost involved. The only step before you can fully get going, if you want to have margin as part of the overall experience, is that we need to vet you as a clinician. So you have to upload your license or your certification to make sure that we know you're a clinician. Other than that, it's a very easy process to onboard.
Awesome.
Well, before we leave, we need to do one last announcement that the Hint Summit is coming up. And you are welcome to come from Ottawa. We'd love to have you. It's going to be in Denver.
Yes.
It's going to be in our backyard. Brad and I are both here in Colorado. It's going to be September 27th and 28th. This is the direct primary care event of the year. Docs, if you're thinking about becoming a DPC practice, if you want to meet other people in the DPC community, vendors that will support your practice, there's going to be healthcare advisors, brokers, payers, lots of fun concerts going to the, I think there's going to be some other activities that the Hint team is going to be putting in. It is a blast. So put that on the calendar and plan to come. This is for everybody that's listening. We'd love to have you.
We've been there, and I can honestly say I'm not just blowing smoke up your nose here, but it is an amazing event. Like, it's one of the best events in the entire industry. It's a ton of fun. So I highly recommend going.
And Fullscript is one of the title sponsors. No, maybe not title sponsor. I shouldn't say that. Our backstage people are just shaking their head right now. But you guys do have a booth. We'll put it that way.
Definitely there. Yeah.
Anyway, cool. Well, thanks, guys. This is fun. We'll have to do it again soon, and we'll see you in Denver.
All righty.
Great time.
Hey, thanks so much, Alex.
Yeah. Have a great day. Take care.
Bye-bye.